Welcome to the Peak Performance Podcast, your guide to optimizing your life one health tip at a time. This podcast is designed to entertain and inform, not to provide medical or health advice. Always consult your doctor when it comes to your personal health or before you make any changes to your diet, exercise, or lifestyle.
Ladies and gentlemen, welcome to the Peak Performance Podcast. I'm Coach Kyle here with Dr. K.
What are we talking about today?
The hole in the ozone layer.
No,
Not
for us.
No, we're not getting into politics or
No, sorry, Earth.
Yeah. But we are talking about ozone. So ozone therapy specifically, and its uses, the levels, and that kind of stuff. So, Doc, what is ozone?
O3. So the air we breathe is O2. Oxygen times 2. Ozone is O3. And the way you make ozone is you take oxygen, strike it against an electric coil. It's going to separate into O's, and some of them are going to recombine into O3s, and some are going to recombine back into O2s.
Oh, that's pretty cool. I actually didn't know that. That's neat. So how does this help our body in any way, shape, or form?
So ozone, when it reacts with our blood, creates something called ozonides. It's O3 minus. And so it has a bunch of super cool healing properties. So it is going to hyperoxygenate our tissue, because typically the way red blood cells work is they carry a little O2 on them. They carry up to 6 of them. But when you give them O3, it means that they carry 6 times 3 oxygen particles. So they can go further before each one runs out. Because the way it works in the body is it's traveling on with the oxygen on its back, and they'll get plucked off by cells as they need. And so when you have more, you just go further before it runs out. So it's bringing oxygen to normally less oxygenated parts of the body. The hands, the feet, the eyes, the heart, the kidneys, places that are last in line, they're getting more.
So oxygen is healing, essentially.
Yes.
And ozone allows you to have more oxygen.
Yes, that's part of it. Second part is ozone has been shown to be able to stimulate your immune system. So it can turn dormant white blood cells into active white blood cells and force them to turn on.
Okay. So is that a negative case in the case of like autoimmunity?
No, so it's actually shown to have what's called immunomodulating effects, which means if your immune system is overactive, it'll calm it down. If it's underactive, it'll raise it up.
That's very cool. I like that. So it's like a natural thermostat. If it's too hot, it turns it down. If it's too cold, it turns it up.
Exactly.
That's pretty neat. So when it comes to ozone therapy, I imagine we're not just drinking ozone gas or smelling it, or
no.
How do you get it in you?
You want to talk about all its benefits first, or how do we get it in? There's more benefits. Let's finish the benefits.
I didn't know there was more benefits.
Yeah. Oh, yeah. So there's immune stimulating, there's hyperoxygenating, there's anti-pathogenic. Ozone kills molds, viruses, bacteria, parasites on contact.
Okay.
So when you introduce it into the body, it helps to kill off some of those bad guys.
Okay, so basically kind of similar effect and a different mechanism as methylene blue.
Yes.
Okay.
The other similar but different thing from methylene blue is that Krebs cycle, the thing that mitochondria run on to make all of our energy. Another bottleneck for them is oxygen. So when we put in O3, we're actually accelerating that bottleneck pathway so that our mitochondria can make more energy.
More ATP means more energy.
Yep.
Okay.
So we've covered immune stimulating, we've covered hyperoxygenating, more mitochondrial energy, anti-pathogenic. The last thing it does is it calms down inflammation in the body. When you hyperoxygenate an area, it calms down inflammation. This is a secondary byproduct.
So basically this is just generalized inflammation throughout the body.
Yep. Inflammation, your body makes, when something's inflamed, it means your body's making a bunch of proteins that attract water. And so when ozone comes through, it just kills off those proteins and the water retention calms down.
Okay, so you might pee out inflammation. That's pretty cool.
Yep.
So is that all the benefits?
Yes.
Okay, that's a lot of benefits.
Yeah.
For one thing.
Ozone's very cool.
Yeah, that's like multifaceted. It's a lot of different areas. So in terms of how to administer it, there are levels to this treatment.
Yes.
Kind of like our regenerative injection episode where we go level by level. Let's start with the most simple form of ozone therapy.
So I'm going to list them all off real quick, and you pick where you want to start.
Okay.
We have, you can breathe it through a bubbler, which filters out the toxic parts of it. And you're just getting like parts of it almost. You can do ear insufflation. You could do rectal insufflation. You can actually do vaginal insufflation. You could do bladder insufflation through a Foley catheter. You can do direct ozone injections called Prolozone, and you can do IV ozone.
Wow.
Those are all the methods to get it in you.
Okay, let's talk about ear and bubbler first.
Okay. So ear, there's doctors out there that definitely say that doing ear will travel throughout the whole body. I typically save ear for ear issues and sinus issues, just local to the ear. You get like stethoscope looking things connected to your ozone generator, and you just wear it for like 10 minutes. Ideally, 2 to 3 times a week for usually 6 weeks to cure your ear issues. And I'm talking like chronic ear issues.
So like chronic sinus infections or ear infections or things like that
Mm-hmm.
from stuff in that system.
Yep.
Okay. So, and then the bubbler.
Same principle. You're just getting it more into your sinuses by breathing it in.
Okay. Do you ever pair them together?
You can. I don't. But you absolutely can.
Okay. So that's kind of, I would say, in my opinion of this, that's like Ozone 101.
Yes. That's base level. You could do this at home.
Okay. So if we take the next step up, you're talking about insufflations.
Yep. Bladder, vaginal, and rectal.
Okay. So you can do the vaginal and the rectal at home, but you cannot do the bladder at home.
Not unless you know how to put in your own Foley.
I'm not going to do that.
There are people that can and do.
Nope. I'm out on that one.
Yep. So bladder is typically just used for cystitis, chronic bladder infection. Actually works really well for it. Vaginal is used for female vaginal issues, chronic infections, yeast infections, whatever other stuff there is. And then there's rectal. And rectal, it doesn't actually treat rectal issues. It treats kind of whole body because your rectum is very well, what's the word? It's got a lot of blood going to it.
Perfused?
Yes, perfused. It's very well perfused. And so when you do rectal ozone, a lot of the ozone is able to enter your bloodstream.
So that's probably the first level of systemic effect, right?
Yes.
Okay, so these insufflations, when we say you can do them at home, we're talking about a personal ozone generator that you buy online.
Yes. I think they used to be like $700. Now they start at like $1,500, $1,800.
Yeah, like supply chain and the parts and pieces just skyrocketed, and now they're more expensive.
Yep.
So in terms of the systemic, the first one is the rectal insufflation. And it's basically a very simple procedure in which you hook it up to your home ozone generator, you fill up a bag, and then you squeeze it into your rectum, and you hold it for a few seconds and then release.
Yep.
Vaginal similar.
Yep.
So if we don't want to do these at home and say we want a more powerful systemic ozone treatment, what's our first step on that?
IV.
IV.
So there's different.
There's levels.
There's levels, and basically all the levels have to do with the quantity of blood and the quantity of ozone. The more blood and ozone, the bigger effects you get. So there's minor autohemotherapy, there's major autohemotherapy, there's multipass, and then there's EBOO.
Okay.
So minor is typically 60 to 100 milliliters of blood combined with equal volume of ozone, put into a bag, let it drip back in.
Okay, so basically it's take some blood out, put ozone in equal parts to it, and then put it back in.
Yes.
Small bag, big bag. I mean, 60 milliliters is it's a pretty small bag.
It's like, it's like what's a water bottle?
It's a water bottle.
It's like a water bottle. I think
like
a water
16
bottle.
ounces.
Yeah. I think it's actually less than the water bottle, but yeah.
Okay. So that's minor.
Yep.
Major, I imagine, is the same thing except more.
Exactly. It's 200 milliliters of blood and usually twice as much ozone, so 600 milliliters of ozone into a big bag. A blood donation is 500 milliliters, so a little less than half of blood donation. But you also get that blood back within the hour. I say within the hour because it's a very long treatment. It takes like an hour per pass because it's all gravity fed, and like you put a bag on the floor and wait for blood to drain out of your arm, fill this bag, then you fill with ozone, wait for it to drip back in.
Okay. So basically you're getting more ozone and more blood treated, but still not a massive quantity.
Correct. Now you can do that up to 3 times. You might be there for like 2 hours.
Okay. I don't love that.
No, it takes forever.
How much blood do we have in our bodies?
About 6 liters, 6,000 milliliters, plus or minus, depending on how big you are.
Okay, so a 200 milliliter treatment is roughly treating
1/30th?
Yeah.
Did I do that math right?
Yeah, I think it's about right. So 3 to 5%?
Yeah.
Roughly?
Mm-hmm.
Of your blood?
Yep.
Okay. So these two are what I very commonly see in the marketplace.
That's because with a $1,500 ozone generator, you can make these happen. So pretty much any place that has a medical license can start to offer these. Even if you only do one a month, it's still worth it to most of these places. Price-wise, minor typically goes for between $200 and $400. Major typically goes for between $300 and $800.
Okay. So say I want more and more quickly. Actually, before we move on to that, how do these two compare to basically the systemic effects of a rectal insufflation?
It takes roughly 3 rectal treatments to equal 1 major. That's the typical rule of thumb.
So a rectal is similar to a minor.
Yeah, basically.
More or less.
More or less. The minor's probably slightly more effective, but yeah.
Okay. So the next step up would be something you called multipass.
Yep. So multipass is the same idea as major autohemotherapy. It's 200 milliliters of blood into a bottle, reinfused back into you. But it's called multi because it runs on a pump vacuum system. So instead of waiting for gravity to fill a bag, there's a vacuum that sucks the blood out of you. And so you can fill that 200 milliliters in 3 to 5 minutes and then reinfuse it with a pump in 2 to 3 minutes. So each pass only takes between 5 and 7 minutes. And so now it's multi-pass because you do that over and over and over. Most places stop at 10 passes, but technically there's no limit.
Okay. So with 10 passes, you can do roughly 2 liters. 2,000
mLs, yep. So about a third of your total blood.
About a third of your total blood, which
Yep.
is significantly more than doing a minor or major.
Yes.
So you said theoretically there's no limit. I personally tested this limit.
Yep.
And I got some wonky side effects around 17 passes.
Yeah, so the more you go, so every time you fill and empty, the bottle gets a little dirtier, but you're just creating die-off, right? And so the more die-off you create, the more your body has to deal with. So when you get to high number of passes, you're just creating a ton of dead stuff that your body now has to process out. Because there's no filter, it's not going anywhere, it's just being reintroduced, and now your kidneys and liver are your filter.
Yep, so that's why I had a detox reaction to multipass.
Yes.
Like I would feel not so good after a multipass treatment, especially a high number of multipass.
Yep, you're getting die-off.
Okay. So one step further, which is what you commonly do, is a process called EBOO. How is that different from a multipass?
So EBOO stands for Extracorporeal Blood Oxygenation Ozonation. It's a mouthful. EBOO. That's kind of a brand name for it. There's EBO2, which is a slight variation. I personally don't recommend EBO2 treatments. I think that there's flaws to them. And then the generic form of it is called ozone dialysis, but no one really calls that. EBOO is becoming, it's kind of like Kleenexes or tissues. EBOO is just becoming EBOO. Ozone. No one says hand me a tissue. They say hand me a Kleenex.
Yeah. Now, don't you have a name that you're starting to call this treatment that's different from EBOO?
What are we calling it?
E-Boost.
Yeah.
So that's just a marketing spin, guys.
Yeah.
We had a patient come in, specifically my father. He's an athlete, and he did the EBOO treatment, and then he went and did a high intensity hill run afterwards, and he said he was breaking his record times, and probably because of the oxygenation.
Exactly.
But he was like, EBOO, this is e-boost. So we are going to start incorporating that as part of our marketing term, but I think it's just easy for people to remember e-boost.
Yeah, there's so many different names. Everyone's trying to make their own right now. So the problem is some of these places are trying to make their own, literally do like 5 a month, and so it's like probably not going to make your own.
Yeah. So the multipass is getting about 2 liters of blood processed. How much blood are we treating during the EBOO session?
3 to 5. Just depends on your vein flow.
So that could be up to like 2/3 or even 3/4 of your whole blood supply.
Yep, exactly.
So more
is more.
Exposure, more is more.
Yep.
To quote my sister, more is more. And so we get more of the beneficial immune effects, more of the oxygenation.
Yep. Now, the question is, why can you handle that much EBOO but you couldn't handle that much multipass?
Yeah, because that would be like 30 passes, and I would probably feel like absolute trash if I did 30 passes.
So EBOO has a filter. It literally has a filter halfway through it. So blood comes out of one arm, runs through a filter, ozone gets fed into it, and then it runs back into your other arm, and it runs in a circle. And so you never have more than 200 milliliters of blood out, same as the other treatments, but the filter's trapping all the garbage so that it never passes back into you. We're not relying on your kidneys and liver. That's why people can feel immediately better, like while sitting in the chair.
Okay, so we are not relying on the body's innate detoxification systems because we are actually filtering out the junk as we kill it with the ozone.
So that's what makes EBOO so special. The other part, it has an inflammatory collection bucket. So when you're sick, you're inflamed. When you're inflamed, you retain water. So EBOO at the bottom of that filter will actually pull away the inflammatory water.
And then I imagine, depending on your level of inflammation, the amount of water inflammatory fluid will change. So the more inflamed you are, the more effective the treatment is for you. You have more inflammatory fluid.
Well, patients love to look at and compare and how much water they've done treatment to treatment.
Okay. So, and is it common you see more inflammatory fluid in the early treatments?
Yes.
Or is some people have, because I've noticed some people are like, hey, I had almost no fluid, and then their second and third one, they have a lot more. What is that coming from?
So,
this is kind of theoretical.
I was going to say something else that I think is actually more interesting. I thought. So I had a patient. She's probably done most number of EBOOs ever of my patients, at least. She does them every week or every other week, and she has for like 2 years. So in the beginning, she produced a ton of inflammation. Over time, we got her down to like barely any water was coming out, and she's a snowbird. Then she left, and she actually went on a cruise to China. And when she came back, ton of inflammation started coming out of her again. And we were like, where's this come from? I was like, you got China exposed, probably. All the just toxins in the air.
It's different
water.
Toxins.
Yeah. And so we EBOO'd her down, and she, again, started producing very little. And then she started painting her house. And she comes in one time, and she's got paint on her finger. I was like, I'm thinking to myself, I'm like, this one's going to be interesting. I'm not going to say anything. Let's see what happens. And again, a ton of water comes out. She's like, where's that come from? I just pointed at her finger. I'm like, the paint.
So basically, your exposure to some degree will indicate how much inflammation you have and how much you're going to pull off.
Yes.
Very cool. So price range for this kind of top of the line treatment?
So we are the bottom. We are $830. Why? Because I don't think that EBOO should cost $3,000. I think that's ridiculous. So we're $830. We set the bottom end. Truthfully, we do 4 to 5 a day. That's why we're able to be at the bottom end, compared to a place that spent 30 to 40,000 on their machine and does like 3 a month.
Yep.
But then I've heard prices as high as 5,000 per treatment.
True.
I think the current highest is 3,000, 3,500 somewhere in California. 5,000 was kind of when it first started. People were like, "Oh, well, this is new, so I can charge more."
Yep, that makes sense. Didn't you? You know, I do want to touch on the machines a little bit, because there's commercial machines for this.
Yep.
And we don't have those.
No.
So can you explain kind of very quickly the different types?
Yeah, so there's pre-made, like ready-to-go machines. There's 3 big companies out there. In my opinion, each of them, there's just something I didn't like about each one of them. And so I kind of set out, and I had a friend in another country. He has very similar practice, and he and I kind of worked together. I won't say what country, because I don't want to, it's not really allowed in the country he's in. But so he and I kind of worked together and kind of developed our own EBOO based on the generic form of it.
Yep. So basically, you kind of, with that friend, engineered a system of EBOO which solved the problems with the current available commercial generators.
Basically, yes.
Yeah, that's cool. So DIY EBOO.
Yes.
That's very cool. Anything else that people should know about EBOO treatments, ozonation?
EBOO has a magic rule of 3. For some reason, people do 1, they're like, I feel somewhat better. They'll do 2, I'm like, maybe there's something here. They do 3, and it's like,
they just start feeling better.
Yeah.
So it's just kind of, we don't know why. It's just one of those things that we see.
Magic of 3.
Okay. So stacking EBOO, what would you stack EBOO with?
Number 1's Methylene Blue. And we talked about this in the Methylene Blue podcast, but Methylene Blue just makes your cells more able to accept oxygen. So when you add Methylene Blue, it just makes the whole treatment work better.
So EBOO, Methylene Blue, and then we also talked about this in modalities. You can add on HBOT to take that even further.
Yep.
It's hyperbaric oxygen therapy.
Yep. And then in terms of EBOO, I like to stack EBOO with my regenerative injections to boost the injections.
Okay.
Because hyperoxygenate your tissue, the injections work a little bit better.
Okay, that makes sense. So we want to give the body the right terrain, if you will, for that healing to take place.
Yep, exactly.
Okay. Is there anything else you would stack EBOO with?
Those are the common ones. There's obviously other things we can stack it with, but those are the common ones.
Yeah. One more one that is that I've seen you do a few times is a peptide therapy called TA1, thymosin alpha 1. I'm not sure if it's allowed anymore. on the FDA's list or
No,
not?
it's fully. You can't get it as a peptide anymore because it's approved medication
Oh,
now.
so you can get it as a medication, but because of the immune modulatory effects of EBOO, if you stack it with that medication that also has immune modulatory effects,
Yep.
you could have a greater immune system benefit.
Yep.
So that's another one that kind of I've seen in the clinic. Okay, well that's ozone therapy.
Ozone 101.
Ozone 101. Thank you, ladies and gentlemen, for joining us on the Peak Performance Podcast. I'm Coach Kyle here with Dr. K.
We'll see you guys next time.
Thanks for tuning in to another episode of the Peak Performance Podcast, your #1 resource for today's top health hacks and facts. You can follow us on Instagram at the Peak Performance Pod or on X at Perform Pod. You can also check out our website and weekly blogs at peakperformancepodcast.online. Again, thanks for watching, and don't forget to subscribe. We put out a new podcast every Thursday. The content of this podcast is provided for informational purposes only and is not intended for the purposes of diagnosing, treating, curing, or preventing any disease. Before using any products referenced on the podcast, consult with your healthcare provider. Carefully read all labels and heed all directions and cautions that accompany the product. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Coach Kyle, Dr. K, and producers, disclaim responsibility for any possible adverse effects from the use of the information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein.